enrollment period for Medicare. But if you're new to the process, well, where do you even begin? Here with answers is Dr. Kenneth Adams, Chief Medical Officer with UnitedHealthcare, Medicare, and Retirement in Texas. Good afternoon.
Good afternoon.
Let's break it down, because Medicare annual enrollment, well, it can be overwhelming. I mean, that's an understatement. So why annual enrollment is so important, and what advice can you offer to help make the process of choosing a plan even easier?
Good question. So 5 things, really. Choosing a Medicare plan is one of the most important decisions a person can make, not only for their health and well-being, but also for their wallet. The Medicare annual enrollment period runs from October 15th through December 7th. Remember that, December 7th, every year. And while choosing a plan can feel complicated, it doesn't have to be. First, you want to check your current coverage to see if it still meets your health needs and see if your benefits will change next year. I know my daughter's having some surgery next year, so we're planning for that ahead of time. Then, number 2, determine if the plan is still a good fit for your budget. That means paying attention to more than just your monthly premium. You should also understand that there are other out-of-pocket costs, including deductibles and co-pays, and those costs can add up. The good news for UnitedHealthcare members is that most will see a stable or reduced Medicare Advantage premium, including nearly 3 million members who will have a 0 monthly premium. So number 3, with continued uncertainty surrounding COVID-19, there are safe and effective ways to find dedicated support in choosing a plan. UnitedHealthcare has the tools and technology for simple, no-contact enrollment.
Now, the Medicare plan you select can have a significant impact, of course, on your health and well-being. What are some of the most important things to consider when enrolling in a Medicare plan?
So that's really important. Your Medicare coverage is set up to ensure you have access to the care you need. First, confirm your preferred doctors and hospitals are available through the plan you're considering. Access to affordable quality care is a big consideration when choosing a plan. Second, don't forget about dental, vision, and other benefits. Take advantage of wellness programs and other plan features that can support you in living a healthy life. And lastly, make sure your medications are covered.
All right, and people are facing important decisions, of course, about their Medicare coverage in the weeks ahead. What are some resources they're looking for help, as they're looking for help or support as they make their decisions?
So I'd offer a few key tips when you're considering your prescription coverage and what you can do to find a location to help with support. I would look at uhcmedicarehealthplans.com.
All right, Dr. Adams, cost for prescription drugs, of course, a concern for many folks. What is important to consider when it comes to your Medicare plan's drug coverage?
So I'll offer a few key tips when you're considering prescription coverage options. First, as I mentioned earlier, make sure your medications are covered and also that your pharmacy is in your plan's network. Number 2, keep total cost in mind. Pay attention to the out-of-pocket costs too, like the annual deductibles and drug copays. And finally, see what other programs or features might be available through your plan to help you with prescription cost savings. For example, UnitedHealthcare is again offering plans that limit monthly out-of-pocket cost to $35 or less per month for all covered insulin.
All right, Dr. Kenneth Adams, Chief Medical Officer with UnitedHealthcare, Medicare, and Retirement in Texas. Thank you so much for your time. For more information on UnitedHealthcare plans, just call 844-693-1430 or visit uhcmedicarehealthplans.com. Benefits, features, and devices vary by plan or area. Limitations and exclusions apply. For more information about Medicare, visit getknowmedicare.com.